Hello, Mr. Presley.
Hi.
How are you today?
Good.
I am your OTA. I'm Shalyn, and I am here to kind of talk to you about some safety precautions for when you go home, because I know your goal is to go home in 2 or 3 days. I'm going to teach you how to safely sit and walk into the bathroom and sit on the toilet and stand up from the toilet. Okay. First of all, something to keep in mind is your body should always be at a 90-degree angle.
Right.
When you sit down and stand up, I know sometimes when we sit down we do this, we stand up, we do the, we bend. We can't be bending. That will have a tendency to throw your hip back out, and we don't want that. And so when you stand, let me come over here to your walker and kind of demonstrate. Turn it around. So when you stand up, your right leg is the one that had surgery, so you kind of put that out, and you use, your foot, and then you use your arms on the chair. Now, if you don't have arms, you can use the seat also. So most of the strength goes on the unaffected leg.
Okay.
And you stand up. Okay, so what we're going to do is do that. I see you have non-slip shoes on, and that's really, really good. Oh, the other thing I want to tell you, this is very important. When you're walking and you have to turn, you cannot cross your legs. You cannot cross your legs when you're sitting. You cannot cross your legs when you're walking. And a lot of times when we are walking and turn, we cross our legs and feet, right? We can't do that, okay? So when we're turning, you need to take little steps, but never twist our foot and never put a leg over another leg. Okay. That's very important. Okay, I already have your gait belt on. I will send you home with these directions also, so that you have something to look at.
Okay.
Okay. And we have arms also on the raised toilet seat, so that will also be helpful. Okay. So what we're going to do, let me know if you need help. I'm going to be by the side of you in case you need help. Do you feel like you need help getting up?
No.
Like from the back? Okay. Go ahead. Okay, stay right there. Let me grab your walker for you. Okay, little small steps. And then bathroom. Okay. Now when you sit down, I want you to back up to the toilet, and you'll do the same thing for a chair. And again, affected leg out. And slowly sit. Here's your arms. These are the arms of the... How was that?
Pretty good.
Okay. We are going to now practice getting up, same as when we did with the chair.
Okay.
Out. And here's the arms. How was that?
Pretty good.
Yeah? Okay, let's walk back up here and sit down. How's your pain level? Are you feeling steady?
Just mild. Yes.
Okay. Again, back up to the chair until you feel it. And again, your leg. Oh, okay. We cannot bend over. Okay. Get straight down. Put your leg out. Your affected leg. Put most of the weight here. And just kind of sit. How's that?
Good.
Okay, it's going to take some doing because you're so used to bending, and I get that, but this is why we're working on this, because it's very, very important. Do you have any questions?
Not right now, but
Okay.
I will ask if I do.
How were you feeling? Yesterday when you got up, you were feeling nauseous and you had to kind of lay back down. How are you feeling today with that movement?
I don't feel nauseous today.
Okay.
I feel better.
Well, you did really well. We will work on this again, but thank you so much for working with me today.
You're welcome.